Hello everyone, welcome to this online section, Mechanical Ocular Trauma. I'm Dr. Howie Chen from Joint Shantou International Eye Center, Shantou University and the Chinese University of Hong Kong. These are the learning objectives today. You are expected to list the classification of mechanical ocular trauma. Within several types of mechanical trauma, broad trauma and penetrating trauma are the most common types. You are expected to describe the clinical features, complications, diagnosis, and management of this type of trauma. Before we take care of the ocular condition for trauma patients, we must consider whether there is any associated injuries such as thoracic, abdominal, and intracranial injury, and whether the vital signs are stable. If there is any injury threatening life, it should be managed first. Life always has priority over vision. This figure illustrated the epidemiology of ocular trauma in Shantou City, China. Generally, male is more susceptible to ocular trauma than female. In children, the primary cause of ocular trauma is home-related injury, while in adults, most are work-related. Mechanical ocular trauma can be classified as closed globe and open globe. Closed globe injury is further divided into contusion, which is caused by broad trauma, and lamellar laceration, which is inflicted by sharp objects. Open globe trauma also has two types: rupture due to broad trauma and laceration resulting from sharp injuries. Laceration can be further categorized into penetrating, perforating, and intraocular foreign body injuries. This picture shows the transmission of broad injury. The impact of the object is on the cornea, but the force can be transmitted to and damage all the structure in the eyeball. In the anterior segment, corneal contusion is manifested as corneal edema. Iris dialysis usually show a D-shaped pupil. The ciliary body may be detached or separated. Hyphema means hemorrhage in the anterior chamber. Anterior chamber angle recess may lead to traumatic glaucoma. The lens may be dislocated or opacified. In the posterior eyes, there may be vitreous hemorrhage, choroidal rupture, retinal contusion, and a traumatic macular hole as the result of ocular contusion. In severe broad trauma, the globe may be ruptured. The wound is usually found at the skin regions, such as limbus and intraocular muscle incisions. In some cases, the conjunctiva may be intact and there is subconjunctival hemorrhage covering the wound of the sclera, so the wound may be acute and overlooked. The wound of global rupture is usually long and irregular. Ocular laceration refers to the open globe injury caused by a sharp object. The cup is usually short and regular. It may be complicated with endophthalmitis and intraocular foreign body. According to the number of the wound size, ocular laceration can be further classified as penetrating injury, which only has an entry site, and perforating injury, which has both entry and exit wound. This is a picture of ocular laceration. In this case, the first consideration is to rule out intracranial injury. Luckily, the patient did not have any central nervous system symptom or signs. The CT scans confirmed that the intracranial structure was not involved. We can also see that the metal passed through the globe. Therefore, this patient had a perforating injury. These are some snapshots of the surgical video of this case. After closing the entry wound in the cornea, the posterior exit wound was identified and repaired. Another type of ocular laceration is intraocular foreign body. It may locate at the cornea, iris, anterior chamber angle, lens, vitreous, retina, and even choroid. The foreign body may be metal or non-metal. Besides the mechanical injury, the foreign body may carry bacteria and cause infection. Furthermore, a metal foreign body may cause chemical toxicity to the retina. The diagnosis of a foreign body can be made based on the clinical examination. Several imaging modalities may help to identify the foreign body, including X-ray, CT, MRI, and ultrasound. Please note that MRI is contraindicated in metal foreign bodies. Surgical removal is the only way to manage intraocular foreign body. Open globe injury may be complicated with endophthalmitis, which is the infection of intraocular tissue by bacteria or fungus. Ocular laceration has a higher risk of endophthalmitis compared to globe rupture. An intraocular foreign body is another important risk factor. In physical examination, endophthalmitis is characterized by the anterior chamber and or vitreous hypopyon. Clinical diagnosis can be made based on history and ocular size, but smear of intraocular tissue, culture, and sequencing techniques should be performed to identify the pathogen. Intraocular injection of antibiotics should be performed as soon as possible to control the infection. Vitrectomy is indicated in severe cases. In summary, in this section, we have presented the topic of mechanical ocular trauma. It can be classified into closed globe and open globe injuries. Closed globe injury can be further classified into contusion and laminar laceration. The power of ocular contusion can be transmitted to all the structure in the eye and damage these structures. Open globe injury may be rupture, which is the result of bruise trauma, or laceration, which is caused by sharp objects. Laceration can be classified into penetration, intraocular foreign body, and perforating injuries. Endophthalmitis is the infection of intraocular structure. Thank you for joining us. Here are some references for further reading.